Good afternoon and welcome. Thank you so much for joining us. Today we are going to share some information on the University of Vermont Larner College of Medicine Master of Public Health program, and we're excited to have you here with us. So I'll start by giving a brief introduction to the program team, and then we'll move on to discussing what is public health and what are some of the key issues that are going on today. And then we'll also talk about an overview of the public health program. So we'll discuss some key information such as upcoming application deadlines and tuition information, which will hopefully answer some of the questions that you have today. And then we'll end the session with a Q&A that will answer any of the additional questions that you might have. But please feel free to use the chat box as we move throughout the slides and put any questions that you have throughout the presentation. We'll try to answer them as we move through the slides, but then we'll elaborate on them at the end of the presentation. So I am Ruth Hackett. I am the Public Health Program Planner, and I help support the program through the UVM Professional and Continuing Education Program. And we're very excited to have Dr. Carney with us today, and Dr. Carney leads the public health program through the Larner College of Medicine here at UVM. And we also have Vika Pleshakova here with us today. She is the public health program advisor and also works in the professional and continuing education department here at UVM. And Vika works directly with the students as they work through completing their program here with us. And Vika is also a great resource for those who are considering their master in public health and considering joining the UVM program community as well. So she's a great resource for any questions that you have about the program as you consider your options in pursuing your education or continuing your education. So with that, I will hand it over to Dr. Carney to discuss more on what public health is.
Great. I can't see the slides yet.
Can you confirm, Vika, if you can see the slides?
No, I cannot see them either.
Oh, good. Our participants can see them.
Yeah.
We're almost there.
We're almost there.
I'm sharing my screen. One moment, we're looking into it.
Oh, well, maybe I'll just start talking while we're figuring out how to show the pictures to all of us. But Vika and I work very closely together, and together we're a team. And Ruth is also part of that. And we do everything we can to bring the most current education and the best advising to our students to help them not only be successful in their graduate level education, but more importantly, be successful and very happy in their careers. And there are a ton of opportunities for our students here. And we're going to tell you a little bit more about that in just a minute.
Did I try resharing my screen?
Yeah, go ahead and share.
Can you see those now, Dr. Carney?
And there we go. Oh,
Yes.
Thank you so much. And absolutely worth waiting for. So this is just a slide to show everyone on the call about sort of the variety of different things that happen in public health. And this is from the World Health Organization. You can go on their website and see what's current this week. And we still are struggling with COVID-19, our pandemic. And that looks like differently in different parts of the world, tracking new variants, making sure that people have the best information about booster shots and how to protect themselves and their family. Monkeypox, the emergency in Ukraine. This is ongoing. This is an enduring health issue for so many people. And then the crisis in Pakistan and some of our weather events that are related to global climate changes. So next slide, please. So this is, again, from the World Health Organization, and this is Health and Sustainable Development Goals of the United Nations. And if you look at good health and well-being, you can see all the many factors that influence these, such as having adequate nutrition and safe drinking water, in addition to access to health care, a place to live, and many other factors. Next, please. One of the more prominent challenges in public health has been trying to address some of the root causes of people's poor health and social determinants of health, social factors that influence our health. And then our neighborhood, where we live, our health is determined by zip code. Our social and community context, our social interactions are so important. And I think that that's been reinforced during the recent pandemic of how hard that's been for people to be isolated from people in school or from their family and friends in our usual way. Economic stability, access to education and the quality of that education, and then access to healthcare, quality healthcare, in particular, primary and preventative care. So many of our students, in addition to learning the science and practice of public health, want to understand how to advocate for that. And those are some of the things that we try and teach our grads.
Thank you, Dr. Carney. Fika, do you want to walk us through an overview of the program and some of the logistics?
Sure. So our program is entirely online and the courses are offered asynchronously, which means you do not have to be logged in for lectures or at any specific time during the day or during the week. So you will be attending all of the modules of the class and completing assignments, tests, or exams by a certain deadline. Otherwise, it's completely flexible, which allows for our many diverse students to be able to participate in this program. We are a generalist program. That means we cover all of the national criteria for the public health programs, and we are at 82 credits, 12 courses, and the culminating project experience. The culminating project experience also includes an applied practice experience where you will get a chance to practice all the knowledge you have gained through our M.P.H and apply it to a real life experience. Next slide, please. So there are three major areas of excellence we are covering through this M.P.H as a generalist program. And though we are a generalist program, you might be able to focus your interest on one of the specific areas that you can see on the slide by taking electives in one of those areas or dipping your toes into each and every one of them. Next slide, please. And so these are the examples of the electives that we offer. And throughout this program, you will be required to take 3 electives. And as I said before, you can take one course in each one of those areas of excellence, or you can focus on one area and take all of your electives in that specific area, be it the quantitative one, where you would take biostatistics or informatics, for example, global and environmental health, where you can take courses like global mental health or climate change emergencies, or you can focus on healthcare leadership policy and management. Going into the details of the admissions requirements. So of course, we require a bachelor's degree to apply for M.P.H. And what we're looking for is a basic understanding of science and math or statistics, because you will be taking highly quantitative courses like epidemiology and biostatistics. So we would like to make sure that you are going to be successful in those courses. And hence we would be looking for a college level course in math or statistics. If you don't have any of those courses, of course, it's not a hard no to your application. We will be looking at your transcripts and your letters of recommendation, basically looking at your application as a whole. And we also offer conditional admission for those students who lack any of the college courses in that criteria. What's required in order to apply for our M.P.H? An online application, resume, transcripts, of course, 3 letters of recommendation, and an application fee of $65. It's a fairly simple process. We do not require any standardized tests like GRE to apply.
Thanks, Vika. Could you walk us through some of the tuition and upcoming application deadline information?
Sure. So currently we're accepting students for spring and summer admission. The December 1st is the deadline to apply for spring start. The courses will begin in the middle of January. And financial aid is available to graduate students in terms of federal loans. And our out-of-state students pay differentiated tuition, which is only $970 per credit compared to $1,700 per credit that undergraduate students pay. We also offer accelerated Master in Public Health students to the students who are enrolled in UVM undergraduate programs, where they have a chance to complete 3 public health courses during their senior year and then finish their M.P.H the following year. So get their undergrad and M.P.H within 5 years. We have rolling admission for summer, and the fall application is open right now as well. It's not a big deal if you miss the deadline. We will be able to accommodate you as long as you get enough time, allow enough time to attend our orientation and get registered for the courses.
Thank you. And as Vika mentioned when discussing our electives in the program, the public health program really reaches a wide range of different areas. So with an M.P.H, you can really go on to many different career opportunities. Dr. Carney, do you want to talk a little bit more about the different career paths that are available to M.P.H graduates?
I would be happy to. The sky's the limit, basically. And I guess from my perspective, public health has never been more important. And there are so many different career opportunities for people with that formal Master of Public Health training. And it's anything in the health professions. Any health professional can benefit from a population perspective that public health brings. In addition, there are opportunities working in county, local, or state health departments, government agencies, both at the state or federal level, non-government organizations. And then you can see a variety of different kind of specialty, a health and safety engineer, depending on which areas that you choose to focus on with your electives, as an example, and just many, many different opportunities for our graduates.
Thank you. Yes, I would agree. There really is no limit on where you can go with a Master of Public Health degree. So that's the end of the slide deck that we have to share today. So please feel free to send any questions that you have in the chat box, and the 3 of us will be happy to answer your questions. While we wait for some questions to come in, we are very proud to be a CEPH accredited program. Dr. Carney, do you want to talk a little bit about what that accreditation means for the program?
Yes, we've always been accredited in the same way that all the University of Vermont graduate programs are accredited through our regional accrediting body. But in addition, our program has the National Council on Education for Public Health accreditation, which is basically the highest seal of quality that and you saw Vika showed you the different areas of public health. We ensure that our graduates have the strongest possible generalist foundation so that they can be versatile and carry out the careers that they are passionate about.
Thank you. We also have great program faculty here as well, with full-time and part-time faculty. And the part-time faculty are working full-time or working elsewhere, so they really bring their expertise to the online classroom of where they're learning, where they work, fully plugged into the public health field. Could you talk a little bit about our public health faculty as well, Dr. Carney?
Sure, I'd be happy to. So we have an anchor of full-time faculty with a variety of different expertise, for example. And then our part-time faculty, some of them bring that public health practice perspective. So they might work full-time at the Department of Health in public health, or at a not-for-profit organization, and then they might teach in our program part-time. What does that bring? That brings over not only the academic perspective, but also how you apply that in a real-world setting. We have faculty who are physicians, nurses, physical therapists, have all kinds of different backgrounds that may sometimes include healthcare, but what we try to do as a whole faculty is bring a whole variety of expertise so that depending what direction students want to take their career, that we likely have someone who has experience in that area.
Thank you. And kind of following up on that question, do you have some examples of what some environmental and global health roles that graduates could be prepared to hold once they graduate from the program?
Absolutely. One of the areas that's been is in increasing demand and increasing interest has been around climate change. And so in that area of environmental and global health, we offer a variety of courses and elective courses. Students can take actually quite a lot in there. What are they prepared to do? They can clearly work in non-government organizations, and they have the fundamentals to understand about how health systems work, for example, but that might be one opportunity that they could do. They could also work for, we have graduates working for the Centers for Disease Control and Prevention in a variety of different capacities. And so again, there's many different opportunities for our grads.
Thank you. And for this next one, I might ask Vika to answer about a conditional acceptance and what that would mean for someone applying to the program.
Sure. In some cases, the students get admit conditionally if they lack a science course, for example, or do not have sufficient math or statistics background. And in that case, we would admit you on condition that you get a B- grade or above in the courses like epidemiology or biostatistics. So once that condition is completed, we will remove it from your application and you continue with the program. But it mostly applies to our quantitative courses like epidemiology and biostatistics. If you do not have, if you do not have a sufficient math background, you could possibly take a mid-level statistics course locally at a community college, just to make sure that you feel comfortable getting into these courses here in M.P.H.
Thank you. That's helpful. And kind of following up on that as well, we have a question in the chat about someone who is currently in a master's program and looking to apply to the M.P.H program after they graduate. And will there be any sort of course transfer credit that comes with that for students who are coming from another graduate program trying to enter the Master in Public Health program here?
Typically with terminal degrees, the credits that have been used towards one program cannot be applied to a different one. But we do accept up to 9 transfer credits into our M.P.H from other universities or internally UVM.
Thank you. And if you had more specific questions on that, you can feel free to reach out to us as well. And we're happy to work with you individually on your situation as well. And another question on the chat is if this program can be completed while working full time. And I think that's a great question and one of the great benefits of our program about the flexibility that it provides being an online and asynchronous program for students who continue working full time. But this is probably something Vika can speak to a little bit more as she works with our students directly who are managing a full-time job and taking courses with us part-time. Do you want to speak to that a little bit more, Vika?
Sure. Yes, most of our students are employed full-time, and in that case, I would not recommend taking more than 2 courses per semester. A lot of our students have families, other obligations besides having a full-time job, and so this would be probably the most realistic course load. You have 5 years overall to complete the program, and so you are very flexible in how many courses, credits you can take per semester. Some students take 2 courses per semester, some take 1. You can stretch it out from anywhere from 2 to 5 years. It's really up to you, and I would be working with you individually on creating a plan that would work for your needs, and it will be very individualized and catered to what you're looking for. And at any point, we can change that plan if you wanted to speed up your graduation. But overall, students have 5 years to complete the program.
Thank you. And another question is, what kind of experiences outside of the classroom and learning experience are come along with the program. So opportunities outside of the classroom to engage and work with organizations or companies and outside of the classroom component of the program. Is that something you could speak to, Vika?
I might jump out. I can jump in here a little bit too. Actually, that's intentionally built into the program. It's called, there's a 1 credit applied practice experience where students have the opportunity, and it's a required part of the program, and they can work with an organization of their choice. And students either currently work somewhere, or they might want to try working at, say, a Department of Health or a public health agency, and they can do that as part of the program. In addition to that, that's the formal requirements. We do make available to students faculty service opportunities or research opportunities that they might be interested in.
Thank you. And you touched on a little bit, Jan, about the applied practical experience. Is that something you could elaborate a little bit more on in the process, either Jan or Vika, and what the applied practical experience is for students and what they can expect?
Well, let me start, then I'll let Vika chime right in. Basically, these are a fall spring course, and we call them just generally your capstone. And part of it is a 5 credit group mentored structured research project, and you end up in a virtual poster session, and you learn to apply the skills that you've learned in many of your courses. And this is something that really helps prepare you for the workforce. Along with that, in the fall and spring, you begin to explore your applied practice experience. That's 1 credit. You identify some place you'd like to do that. And we work with the site that you're going to be working in, and that can be anywhere. So, and some of our students live all over. So it might be a health department in the state that you're living in, or an organization that you've really just been wanting to get to know and may want to work there as part of your next step in your career. And so then we have a requirement for a couple of products that the agency you're working with would find helpful, and our students develop those as part of their experience for doing that. So that's conducted in the spring. And you plan for that in the fall, and it's 1 credit, and all of our students do this in a variety of different locations and types of organizations across the U.S., mostly across the U.S.
Thank you. Yeah, I know that experience is really valuable for students in our program once they graduate, particularly when they're looking for employment afterwards, because they have real experience in an organization that's local to them as well. So another question is, what differentiates the UVM M.P.H curriculum from other programs that are also CEPH accredited? Is that something that you want to touch on, Dr. Carney?
Yeah, let me try that. First of all, we are a generalist program, and intentionally by design, we're a strong generalist program. So when Vika showed you those areas of excellence, when you come out, we want all of our graduates to feel absolutely confident that you have the skills to be successful in your career right away. And with a level of versatility there. As an example, we are deliberate about our preparation in the quantitative sciences. People come in, you get biostatistics and epidemiology. You get to use that in your group project that you do as your capstone. And so when you go out into a career, you won't be worried about not knowing how to do that. You'll have had some kind of experience doing that. Likewise, you get experience in a range of environmental and global health, and also health policy, leadership, and advocacy. Many people, or the careers of many people in public health, also intersect with healthcare, and we want our students to be comfortable with that. I would say that what distinguishes our program is we're a very strong generalist program, and we want our graduates to be confident and versatile, that they can be successful in a wide range of public health careers.
Thank you. And another question on, does UVM offer workshops for preparation for CEPH exams?
We do not currently do that. And through our advising, we can let students know how to best prepare for that, but not currently.
Thank you. So we can give it another minute or two to see if any other questions come through the chat. But while we're finishing up, Vika, do you want to talk a little bit more about what might the next steps be for someone who's interested in applying to the program?
Sure. I offer advising sessions, can be phone or online, for prospective students, so we can look at your individual situation and see what would work best for you. And then we can come up with a preliminary plan and decide when would be a good semester for you to start. Another good thing about this program is that it's very flexible in terms of when you will be able to start and how you're taking those courses, because unless there are certain prerequisites, the courses do not have a specific sequence in which you have to take them. So you can certainly start with a course that looks appealing to you, or you can jump right into the electives if you're interested in taking them. And also you can take public health courses before applying to M.P.H if you just wanted to see what it's going to be like and to make sure that this is absolutely is for you. We have a question again that how long does the program take to complete? The timeline is 5 years. So anywhere from 15 months if you start in the summer to 5 years. But most of our students complete the program within 2 to 3 years. And to go back a little bit to talk about applied practice experience, I know a lot of students who work in the public health field already may want to do the applied practice at their job site. What we recommend is that maybe looking for an opportunity within a different department and having the supervisor not be your current supervisor, but it is certainly possible. And then we would work with the supervisor on site who will be overseeing the project that you'll be working on to make sure that we grade your work and assess your knowledge. And the applied practice experience is only 20 hours in person, but then there's certainly time that you would need to devote to complete the module online, write a short reflection paper, and complete a rubric. So it is a project. Besides doing your on-site work for a minimum of 20 hours.
Thank you. So I'm not seeing any other questions come through the chat, so I think we can go ahead and wrap up. But I want to thank you so much for joining us today and bearing with us through the technical difficulties at the beginning. But if you have any other questions, definitely feel free to reach out to you, and we're happy to help support you and answer your questions. So thank you.